name is Gary Lambert. This is my full head-to-toe health assessment. Hello, Miss Lambert. How are you today?
Pretty good.
My name is Gary. I'll be your nurse. We are going to do a head-to-toe assessment today. I'm just going to take a general look at your whole well-being. I'm going to look at your head, your eyes, your nose, all the way down to your feet. What problems bring you here today, or is this just a general checkup?
I'm feeling pretty good. This is just a general checkup. I haven't been in a while, just to make sure everything is going good.
Okay. Do you have any questions?
No.
Alright, the first thing we're going to do is I'm just going to take your vital signs. You may have had this done. I'm sure you've been to the doctor before.
Unfortunately.
The first thing we're going to do is take your blood pressure.
Okay.
Have you ever had breast cancer, a mastectomy, or anything like that?
No.
No? Have you ever had a lumpectomy?
No.
Have you ever had a stroke?
No.
Alright. I'm just going to put this around your arm. You're going to feel a little squeeze, but if you've had this done before, just leave your hand relaxed like that. Okay. Go ahead and just leave it like that. There you go. Now what this does is we're just going to, like I said, check your blood pressure. Just go ahead and relax. Alright. Start to get tight and a little uncomfortable. You ready? Okay. Okay, good. Miss Lambert, your blood pressure is 120/80, which is normal for adults. Do you have any family history of high blood pressure or low blood pressure?
My great-grandmother had high blood pressure.
Okay. Okay. Alright, I'm just going to take your pulse real quick. Okay, your pulse is good. It's about 78. And your respirations are about 18, which is also normal for an adult. I'm going to take your temperature real quick. You don't have any hearing aids in or any problem with pills being in your ear?
No.
Alright, so just going to take your temperature from your ear. Okay. 98.9, which is the average temperature, so that is good too. Alright, well, do you have any questions so far? Alright, now Miss Lambert, I'm just going to take a look at your skin. I'm going to start kind of around your neck and look at this. Do you have any cuts or bruises or any skin lesions, open sores or anything like that?
No.
Okay. Exam. Let me see it. Really? No problems there. Let me take a look at your back. I noticed that you have some moles on your back and all that. Have you had troubles with that in the past?
I've had one removed. Just.
And what was the result of that? What kind of?
It was negative.
It was negative. And did they cut it out surgically, or did they just do some what?
They did. They cut it, and the doctor stitched it up
say anything. Do you have any family history of cancer or anything like that, or skin cancer?
Not skin cancer, breast cancer, but not skin.
Okay. Okay. Any other moles unusual that you recognize that have?
Not any abnormal, discolored moles that I'm worried about here.
All right. I'm just going to take a look at your feet here and see if there's any edema. Do you ever have any trouble with swelling in your feet or in your legs or anything like that?
No, only when I'm pregnant.
You're pregnant. And how many children do you have, Miss Lambert?
3.
3 children, huh? When was your last pregnancy?
My last pregnancy was in 2013.
And was there any complications with that? Did you have any trouble?
I had some kidney stones. I had 2 hospital visits with kidney
With
stones.
kidney stones, all right. Well, do you have any questions for me?
No.
All right, now I'm just going to kind of do a general neurological assessment. What we kind of do here is just make sure that everything's okay with your mental functioning, kind of. We can sometimes detect strokes and things like that that might have happened in the past. But I'm going to ask you, do you know your name?
Yes, I do.
And what is that?
Misty Lambert.
Okay, do you know where you are?
Yes.
And where is that?
261 Riverview Drive.
And about what time of day is it?
It's about 8 o'clock.
And do you know what's going on around you?
Yes.
And what is that?
I have children that are sleepy, and my husband is doing his assessment test.
Okay, very good. All right, well, your reactions and all that let me know that you're not in a coma. I would give you about a 15 on the Glasgow coma scale.
That's good.
I'm going to ask you now, can you smile for me real big? Can you frown? Will you stick out your tongue? All right. I'm going to ask you here, can you feel this?
Yes.
What am I doing?
You're squeezing my finger.
And how about this?
Tickling my feet.
And do you feel this?
Yes.
And on the side, do you know what I'm doing?
Yes.
What am I doing?
Squeezing my foot.
All right, very good. Do you have any questions for me?
No.
Yes, good. Good. All right, Miss Lambert, now I'm just going to take a look at your head pretty much. I'm just going to look at go ahead and look at me. Do you ever have any burning in your eyes or any pain, excessive
No.
mucus or anything like that? Okay, open your mouth. Open a little wider. Any sores in your mouth, any pain, any bleeding when you brush your teeth or anything
No.
like that? No. Okay. I want you to look at my finger. Okay, I want you to look at the corner of the room over there, and I'm going to just move my finger towards you. Okay. Alright, I'm going to shine this light in your eyes. Just look straight ahead. Okay. Over here, just look straight ahead. Alright. I'm going to do the same thing. I want you to look over in the corner of the room. Alright. Thank you. Do you have any questions for me?
No.
All right, Miss Lambert, I'm going to hold up this piece. I want you to read the smallest line of letters that you can see.
Okay. A D E Z G M P Q R Z.
All right. All right, now Miss Lambert, I want you to close your eyes, and I want you to tell me what side you hear a sound on.
Left.
Okay. And again.
Left.
All right. Now, again.
Right.
And one more time.
Left.
Okay, good. Very fun. Now I'm just going to take a look at your chest and look to make sure everything's symmetrical. I'd look at her anterior, her posterior, and laterally to make sure that everything was symmetrical. Alright, now Miss Lambert, I'm just going to have you take a deep breath. And exhale. And again. Alright, now this time I want you to take a breath and I want you to say 99 as you exhale.
99.
Okay, and again.
99.
Alright. Now what I'm going to do here is I'm going to palpate your lungs. Alright, here we go. Okay, Miss Lambert, now I'm just going to listen to your lungs. I just want you to breathe normally. And pause it. Alright, I'm going to listen to your lungs, Miss Lambert. Just breathe normally. Okay, now listen to your back. Alright. Everything sounds good there. Do you have any questions?
No.